The most common type is a double J stent. It has one coil in the kidney and one coil in the bladder. And the reason that they are placed most often is in the emergency setting in a patient who is passing a stone and either has severe swelling of the kidney causing kidney dysfunction, they have an infection, or they are just in intractable pain. So any of those are indications for you to have a stent placed. Oftentimes in the emergency setting, we're not able to do a ureteroscopy or an ESWAL or a PCNO. Those surgeries take time, and so those are considered to be elective procedures. But any hospital will allow us to place a stent and alleviate that patient's pain. And stents take about 5 minutes. People kind of run the gamut in how they feel after a stent is placed. Some people feel better. It is undeniably better than a stone. But some people feel great and have no problems with it. Most people kind of fall in the middle and have a little bit of frequency, a little bit of urgency with it. And some people have really severe pain, especially patients who have really narrow ureters that are already tight. They have a hard time passing very small stones. They really feel those stents. And so some people just feel better with the stent in, and they are either unable to follow up, or they forget that they have it, or they just, get busy with life and they forget that that stent is in. But the body knows that's a foreign object. And so the body will start to form stone around that stent. So you'll get stone on the top coil, which is in the kidney. You'll get stone on the bottom coil, which is in the bladder. I've seen 3 centimeter, 4 centimeter, 5 centimeter bladder stones with another 3 centimeter plus kidney stone. And so those can be really challenging surgeries because you've got to figure out a way to get rid of both stones, and they're connected via the stent, and you can't always send a camera from the bladder to the kidney just because the stone is in the way. So it just becomes a little bit of a more complex procedure. And so the way I typically tackle it is I take care of the bladder stone first. I do a cystoethalopaxy, break up all that bladder stone, and then I go up and relieve as much of the distal ureteral stone that I can. And then I let the patient kind of rest. And then we go back to the kidney side and we clear out the kidney stone. We try and go down and relieve as much as we can. And often by that point, we are able to pull the stent up and out through the back.